team. This is our button cutout pliers. As the word explains, it is used to create cutouts for buttons to be placed. So placement of the button is important. I'll just teach you how to form a cutout. You need to place the cutout plier on the half, or at least not more than 2/3 onto the aligners, and form a cutout. And you can see there is a sharp edges forming, which basically hurts to the patient. It has to be polished off and need to create a smooth surface. See, it's basically engaging into my skin. It basically tears off the mucosa if you are using it onto the patient. So you have to smoothen it off, but before smoothing it off, you need to just round off the edges. You can cut it with the help of cutout plier also. You can see the edges are now blunt, as I have removed it with the cutout pliers itself, and I can use any of my polishing burrs to smoothen the surface. Now I'm going to tell you how to place buttons. So whenever you're placing buttons, their aligner should be on, and the placement of button is very important, and it's quite tricky. If you are placing the button in the center and there is space around the cutout, there is space for the teeth to move, and the aligner stays in the position, but the teeth slightly mesialize if we are engaging the elastics in the direction of mesial movement. Same way, if your button is placed in proximity of the aligners, this basically prevents your teeth to track in, because the aligners becomes the anchorage unit, and your buttons don't tend to mesialize the teeth as because it is engaging the aligners. So it forms an multiple unit anchorage as aligners are in touch with the buttons. But in this case, there is space for the teeth to track in. 1 mm of movement can happen of just one teeth. So the placement of buttons is very important. How you do it: if you keep a space around the buttons, the teeth will move. If you keep no space in the direction of the movement of the teeth, it basically gets engages with the aligners, and it forms an anchorage, multiple anchorage unit, and the teeth doesn't move.